The great prostate problem. Thank you for asking me to talk about the prostate problem. The prostate word, I must say, is now so commonly heard that each and every man above 50 would talk about the prostate. Prostate is an organ which is situated at the base of the bladder. Now every man has it, and as the age advances, there is increase in the size of the prostate. Now majority of the prostatic enlargement is benign, but you can get infections inside, what we call as a prostatitis. When it gets grown because of the age, we call as a benign prostatic enlargement, or what we call as a BPH, or you can get cancer in the prostate. Now interestingly, symptoms in all three categories are more or less same. So it's extremely important that we make a distinction that what is causing the prostate problem before we embark on the treatment on the patients with the prostate. So in the young patients, you can get symptoms of prostatitis, where patients would get pain, discomfort in passing urine, the stream is very weak, they have heaviness in the perineum, and they are uncomfortable while passing urine. Now this prostatitis usually happens in young patients, usually in the range of between 40 to 50. Now if you are diabetic, if you are immunocompromised, the chance of prostatitis is much more. Now the second category is a benign prostatic enlargement, where after the age of 50, there is progressive increase in the size of the prostate, maybe because of the hormones, maybe because of the growth factors, and patients would get the enlarged prostate. It's like you are graying your hair, developing a cataract in the eyes, this prostate enlarges, and this is called as a benign prostatic enlargement. Now when I tell you about prostate cancer, you will get really surprised. At the age of 40% of men can have a very microscopic focus of prostate cancer within their prostate. Now, isn't it alarming? But it can be so microscopic, and we still don't know, even if science has grown, that microscopic focus would ultimately result in a full-blown cancer. Now, at the age of 50, there is about 40% chance of having a microscopic focus of cancer. At the age of 60, it can be around 50%. At the age of 70, it can be about 60% patients can have a microscopic focus of prostate cancer. Now, we need to have a differentiation between the prostatitis, the benign prostatic enlargement, and a prostate cancer. So when we talk about a grade prostate problem, we have to make sure what we're dealing with. So what we do on clinical practice after listening to the patients, we do a rectal examination, which is called as DRE. It is extremely important to have a feel of the prostate, whether there is tenderness or not, whether there is an infection or not, and sometimes you can feel the prostate a bit hard and nodular, which is suggestive of probably an advanced prostatic cancer. Now what is important is to do a basic abdominal ultrasonography. We do a test called as PSA, which is Prostate Specific Antigen test. So unless you do this test, when the patients present with prostatic symptoms, you cannot differentiate between whether it's a benign prostatic enlargement, prostatitis, or prostate cancer. Now this test is not one of the best tests in the world because it has false positive and false negative. It's prostate specific, but it's not that prostate sensitive. But still, worldwide, this PSA is used as one of the important tests to diagnose the prostate cancer or to differentiate between the benign and a malignant prostatic lesion. Once we have the results of the PSA, if the PSA is normal, clinically it looks like more of a benign prostatic enlargement or prostatitis, then perhaps we have a choice of treating these patients with medical line of treatment or probably an endoscopy resection or a laser for benign prostatic enlargement. If you have a suspicion of prostate cancer, then subsequent tests should be done in the form of transrectal ultrasound guided biopsies to confirm the diagnosis of the prostate cancer. Now what is a safe PSA? I don't think there is safe PSA in the world, but if the value of the PSA is about less than 3 nanograms per ml, then perhaps In presence of a normal rectal examination, normal ultrasound, normal transrectal ultrasound scan, and no infection, very less likely that the man would have a prostate cancer. But anything beyond that, between 2.5 to 3 nanogram per ml, or any suspicion on clinical examination, any suspicion on imaging, one should persuade the things further and get further investigations like an MRI, the biopsy, and take the treatment of prostate cancer as per the stage of the disease.